So Thanksgiving is just over a week away, and millions of people are preparing to travel around the country to spend time with their loved ones. And that has health officials concerned about a holiday surge of the coronavirus. Joining me now is Dr. Dale Bratzler, OU Health's Chief COVID Officer. Dr. Bratzler, as always, good to talk to you.
Yeah, good morning.
So a lot of folks skipped Thanksgiving and Christmas last year. I know I was one of them, didn't see my family. So I know people are just eager to get out there and spend time with them this year. What are the odds that we see a holiday COVID surge as a result of that?
Well, so right now we're seeing cases go up in Oklahoma, and I think you're probably aware that in the United States, cases are going up currently. There's a big surge of cases in northern states right now, and immediately to our west, so Utah, Colorado, New Mexico, and Kansas, they're all having outbreaks right now. So we could see some additional surges from holiday gatherings.
What are the outbreaks now being attributed to? Is it the unvaccinated? Is it people not getting vaccinated?
Yeah, I think it's a combination of two things. One, colder weather. So we're seeing that the northern states get hit really hard right now, and that's because during cold weather, people come indoors and congregate in indoor settings. One of our concerns is whether it gets colder in Oklahoma. And also, as you mentioned, just the large number of people in the United States that are still unvaccinated. We have a lot of people in Oklahoma that are not fully vaccinated yet, and that does raise some concerns.
You mentioned that we could see a surge this holiday season. How will that compare to last holiday season?
Well, I don't think we're going to see the big surges that we did before. And again, I want to encourage people, if you want to get together for Thanksgiving, Christmas, particularly if you're fully vaccinated, I think it's very safe to do so. But I think we could see cases go up. We've seen just literally over the past week in Oklahoma, the number of new cases daily has gone up by almost 200 cases a day.
So you're saying it's safe if you're vaccinated to get out there and enjoy time with your family. Are you encouraging masks, social distancing this time around? Is that a priority, or are people generally safe?
Yeah, so in general, if you're going into indoor settings where you don't know the people that are around you, or if you're shopping, you're going out into large crowds, we still do recommend that you wear a mask when you're indoors. I think if you're around immediate family and you know everybody's vaccinated, I think you can do those activities very safely. And while we always encourage masks, I don't think you have to if you're with family and you know they're fully vaccinated. The other thing I'll point out is that any activities that you can do outdoors are always going to be safer than indoor activities because the virus isn't transmitted as easily from person to person when you're outdoors.
I want to ask you about booster shots here. Dr. Anthony Fauci said eligible Americans should, quote, by all means get their COVID booster shots. Where do you stand on booster shots? Should folks be running out now to get them, or are we still kind of waiting to see what happens?
Yeah, so I strongly recommend booster shots if you're in one of the categories for which they're promoted. So if you're over the age of 65 or older, you should get a booster shot. Or if you're 18 to 64 years of age and you have any of those underlying conditions that put you at risk for the complications, obesity, diabetes, asthma, heart disease, things that will make it worse if you do get COVID, we strongly recommend that you get a booster dose. And of course, high-risk occupations, first responders, healthcare workers, teachers, and other people that are immediately in the face of the public that are in a high-risk occupation, we recommend it. Anybody that got Johnson & Johnson, anybody should get a booster dose after 2 months after the single dose that they got first.
So you're saying if you're not in one of those risk groups, if you didn't get the Johnson & Johnson, getting a booster is not necessarily a priority?
Well, right now, there is no official CDC recommendation. I think you've heard that several states have now approved boosters for everybody. And I honestly think that we will eventually get there as a national recommendation. But right now, we know that younger people that are fully vaccinated, their risk of hospitalization or complications of COVID-19 is much, much lower than an elderly person who, even if they're fully vaccinated, if they get COVID, they're more likely to have complications.
I thought this was interesting. There was a study out of Singapore that found that 2 Pfizer shots and then a Moderna booster was more effective than 2 Pfizers and then a Pfizer booster. Have you seen any evidence of that? Does it matter the type of booster that you get if you're getting a booster shot?
Yeah, the only really good data I've seen where they did a crossover study, the NIH looked at people who got either Pfizer or Moderna or Johnson & Johnson and then randomized them to get one of the 3 other vaccines as a booster. And what they showed, the only thing that showed up very clearly is people who had gotten Johnson & Johnson first and then went on to get one of the RNA vaccines, Pfizer or Moderna, had a much greater antibody response than if they got a second Johnson & Johnson shot. But otherwise, when you looked at Pfizer or Moderna, getting a booster the same really didn't make much difference.
Okay, good to know here. Before we let you go, I mean, you mentioned a bit of an uptick in cases here in Oklahoma. How are we doing here in Oklahoma? What's your outlook here in the next few months heading into 2022?
So I want to make it clear that we're so much better off than we were on August 30th, when we were seeing 66 new cases a day per 100,000 population. That equated to about 2,800 Oklahomans getting infected every day. So much better now. But yesterday, we've gotten down to about 550 new cases per day in Oklahoma on average. As of yesterday, we were approaching 800 new cases a day. So it's gone up by about 200 cases a day just within the past week. So I just encourage people, don't let your guard down yet. This isn't over yet. I don't think we'll get to a big spike like we had before, but it's not going to go away for a while. And now we're entering the winter months where people are indoors, coming close together, the holidays. It's just not done yet.
Don't let your guard down. Good advice there from Dr. Bratzler. We appreciate your time as always, sir. Thank you very much.